Itagat kogeny chitab Kalenjin kimite ak daktari Dr. Ashni Malde ne netech akobo ole kitoretitoi borto asikonyagei inegei. Nito ko kebeberta nebo konyoiset neter ak konyoiset nebo kotugul nebo sipitali. Kobate kit nekiyoe ko ketoret kebeberta ng'ung nebo borto netindoi kaimutiet asikonyagei inegei. So explaining daktari to our viewers reminding them about what regenerative medicine does. It's actually regenerating. Well, before we took our break, we were discussing about, you've taught us so many things, but let's shed more light on the hair transplant. Who is eligible for these hair transplants?
Okay, so a lot of people suffer from alopecia, different types of alopecia. When I say alopecia, it's basically losing hair. You'll often see in the African culture that most women lose hair through traction alopecia. What does that mean? The braiding and the weaving that has been done for years, the pull, allows the women to lose hair from the front because there's so much of tension. And so it's called traction alopecia. And most women you will see suffer from this, especially postpartum, because the hair doesn't grow back. So you'll often see that the hairline has really receded to the back. And now this is where you're a candidate for a hair transplant. Otherwise, generally you will see men have the general balding, either at the crown or in the front, because the hairline is also receding. This could be because of anything: genetics, age, lifestyle. A lot of youngsters these days constantly wearing caps. They're losing hair faster, the gel, all these things. And so they're also candidates for hair transplant. You could have lost hair because of burns or because of going through cancer, more like the treatment or chemotherapy or radio, whatever. And so you're a candidate for hair transplant. You'll see the old men, they have hair at the back, even if there's a full kipara, as they say. That hair is the strongest hair, and that hair is what lasts a lifetime. And so we are removing that hair from the back and replanting in the area of the baldness. It doesn't mean we make you bald at the back, of course. We're removing only a few hair and replanting. So we maintain the back, but we're replanting in the front. We also have something called alopecia totalis and universalis, which means they just don't have hair anywhere, maybe the whole head. There are some patients who don't have hair on the head, they don't have the eye completely. They don't have eyebrows, they don't have eyelashes, they don't have hair on the hands, on the legs, anywhere in the body. We also have a treatment for that. Unfortunately, that will not be a hair transplant because we don't have hair to remove from anywhere.
To replant.
To replant. But we do have treatments for that. I've just successfully treated a 6-year-old girl who had alopecia totalis. So she did have a bit of hair on the head, but no hair anywhere else in the body. And it's been about 5 months now. She's has a head full of hair. She grew back her eyebrows. She's grown back her eyelashes. She even has a little mustache. Not good for a girl, but yes, that's normal.
Yes.
She started having hair on her hands. So it was a very successful result that we got. So yes, we do have the hair transplant. We also have treatments like the GFC, which is the regenerative medicine, the stem cells, for people who have thinning of hair. They've not lost the hair completely, so they're not bald in any manner, but they just have thinning. You know, even just generally post-COVID, we've seen that we really suffer from hair fall. Many of our patients complain that the hair is so thin, so brittle, so frail. So this is where we use the GFC now. We inject the stem cells back into the scalp, and it allows the hair to grow faster, much thicker, much healthier. We also have supplements, so we do have supplements to stop hair fall. We have supplements to make the hair grow thicker. We have supplements to remove dandruff. You know, we often see most people suffer from dandruff. So we do have different supplements as well. So a whole treatment, everything for hair. Yes.
Awesome. Would you take us through some of the supplements that
Yes, of course.
do a lot, good job?
Yes, as I mentioned, the sunscreen.
Yes.
We made sure that we formulated a lot of our products for darker skin type. It's often hard to understand skin of color because a lot of products back in the day were just made for the Western world and they were not suitable for us skin of color. I don't mean to be biased in any manner. So we now introduce products that would suit skin of color. So of course we start with the sunscreen. We have a lot of oral supplements. When we're moving towards regenerative medicine, we're not giving you a lot of medication. So we're giving you more vitamins, more minerals, collagen supplements, supplements to grow the hair, which is biotin, which is purely vitamin B7, magnesium, zinc. So all these in form of supplements. We advanced ourselves in such a way that you don't have to take them as just as tablets, Sometimes it's hard for people to swallow tablets. You don't also want to get to that phase where you're taking 50 tablets like a bowl of cereal in the morning. So we made a lot of our supplements effervescent. You just put them in water and you drink them like a juice. So yes, we have vitamin D, we have collagen, and they also benefit for a lot of these issues. Like a lot of patients suffering from hair fall, vitamin D really benefits them to stop the hair fall. You will see patients who have wrinkles on the face, collagen really benefits them. You will see in a lot of areas in Kenya there are people who have depigmentation of the lip because of the sun, and it eventually turns very painful. The collagen supplements really help them. It actually reverses the condition completely. So we try to formulate a lot of our products to work around regeneration, and so we call them supplements because they're not medication, but they're just helping you maintain or making your skin, your hair, your body better. Yeah.
Awesome. Awesome. That's helpful a lot.
Thank you.
Yeah, Daktari, there is this problem also. You see in so many people, what do you call?
Keloids.
Keloids, yes. Keloids. Very common.
Because you touched the ear, I understood.
Yes. And where there is a scar.
Yes.
Just what causes them?
It's actually just excess growth of fibrous tissue, and mostly darker skin types are prone to keloids. And so you may or may not understand that you have keloidal skin. Also, there is this thing of you can pierce your ears and not have a keloid, but you can have a C-section scar and have a keloid. So sometimes it's just different parts of the body that work differently, as in react and then have the keloids appear. But we do have a treatment for it. We do use an injectable, which is a medicine. It dissolves the keloid completely. We also do laser treatments for it, and we remove the keloid completely. Very successful stories. I just a few days ago had a patient who messaged, he had a really big keloid on the face. They could even just come from shaving, from razor bumps, just having a small pimple, and when they keep itching it because of the trauma and the friction, it develops into that fibrous tissue which becomes a keloid, and it keeps spreading because it just keeps growing. It's a very aggressive fibrous tissue. And that's why you see that sometimes they're so big on the ear. But we easily remove it. Even the ones on the ear, we just use the laser. We slice off the keloid completely. We don't even disfigure your ear, so we make sure we maintain your earlobe or whatever it is, part of the ear. And we just maintain by giving you injections every month for a few months. And I haven't seen the keloids coming back. Yes.
It's also common at the back of the head.
Correct.
For men.
Yes. It's only it's from the razor bumps. So razor bumps are basically when they shave, the hair fails to come out and it starts growing inward. And then because they will itch it, because it gets itchy and it's irritating, now that develops into a keloid. And likewise, that's the same thing that happens at the back. Because when they go to the barber and they get shaved, they develop those razor bumps. and then those eventually turn into keloids. But it's very easy to remove and very easy to maintain. However, we also give them, you know, like something that they need to take care of. So if you know you're prone to keloids, the next time you go for an ear piercing, you ensure you're already injected immediately after the ear piercing. So we have prevented the keloid from happening. Yes.
So what about those who have the keloids on in this area when they're shaving, they already have, and the skin is already very bald? Do you rectify?
So we, unfortunately, when we remove the keloid,
Yes.
the hair will also go away. So the skin where we have removed the keloid, the hair may not grow back. But if somebody really needs that beard back, then we have the hair transplant.
you can do the hair transplant.
Yes, we do beard transplants, we do eyebrow transplants, we do eyelash transplants. So we can transplant your hair for you anywhere you want.
So that's a solution to the ladies who love the very long eyelashes.
That's true. That's true. Yes.
End of artificial now.
End of artificial. So it's pros and cons, of course, because end of artificial, for those who want something long term, yes, it will last long. But they last about 6 to 7 years. The eyelash hair doesn't last that long. The one on the eyebrow and the head lasts about 20 years. Yeah.
So it has some time span.
It does, yes.
So after that, you come back for replanting.
Correct.
Yeah.
It doesn't go away in one day, but it will start shedding off again. Yes, and then now you can plan to do another one. You can actually do 3 hair transplants in a lifetime.
Wow.
So you have that opportunity. Every 20 years you can come back for another
you can plan.
one.
That's a good time.
Yes.
You can plan yourself to come back in 20 years. I mean.
Absolutely, absolutely. My eldest patient was 82 when he got a hair transplant done.
Really?
And he's so happy. It's about 6, 7 years now. He has a head full of hair. It will last him another 20 years. I don't think he'll need another one.
Sure.
Yes.
But he's looking good and satisfied.
Absolutely.
With the end results.
Yes.
That's awesome. What other diseases do you help cure?
I don't really cure any diseases because I'm not a specialist in that area. But we do just help you with any hair and skin conditions. And because of venturing out into regenerative medicine, the stem cells and the functional medicine, I rely a lot on lifestyle changes, or we want to better your lifestyle. And so like the antioxidant therapy I was talking about, it's basically an IV drip, and it's a cocktail of vitamins, minerals, high doses of antioxidants. The antioxidants are what the name suggests itself, antioxidant. The oxidant is the oxidative stress in your body. So I'll simplify that for you. It's like rust on a metal. And so when your body has rust, that is the oxidative stress. So what we are doing is we are removing the oxidative stress. And so we're making your body much better in all manners possible. And so a lot of people who do the antioxidant therapy, they say their energy levels are very high, immunity is boosted. It saved a lot of people from COVID, or even if they did get COVID, it wasn't as severe as someone else. So it's a complete lifestyle change. It has helped so many premenopausal, menopausal women get rid of their, symptoms. And so it's a total lifestyle change, and all we're doing is giving you something very natural. Everything is made in your body. We're just giving you a surplus, and it's through an IV drip, so you're benefiting in all ways possible.
Wow.
Yes.
When you say it helps people, especially when they're pre-COVID or post-COVID, meaning it helps with the system.
Correct, the immunity. Yes. As I mentioned, we have one of the ingredients that help to remove the excess mucus in the body. So when that happens, your immunity is boosted. So you'll often find you have less flu, less colds. People with asthma are treated, people with COPD, which is, any kind of lung disorders, may not treat you completely, but definitely make you much better. Yes. And that's why when your immunity is built now, chances of having flu and then chances of having COVID are much less.
Yes. Yeah, there is this common thing also about gastritis, whatever, and then they told you to fast, I don't know what. You have alternative.
Correct. I've seen that a lot of people, when they take the vitamins and the minerals or the drip, it really helps with gut issues. And gut health is so important. When you maintain your gut health, then everything else in your body also starts getting better. We give things like zinc, which really improve your gut health. The magnesium does as well. The antioxidant that we're talking about improves gut health. So I'm a prime example myself. I used to suffer from chronic acidity, and now I don't have it at all. Yes, and so I do see a lot of my patients talk about it as well, and it does help a lot of patients. Yeah,
because there are some people who can't even eat oranges.
Correct.
So they can be treated and start enjoying the oranges like everyone else.
They need to come and look for me.
Yeah, right. Yes, that is beautiful. So with your patients, when you do the statistics, what kind of patients do you see most?
In terms of
what are they coming to look for?
Everything.
Everything.
One will come in for the skin.
Yes.
Eventually end up getting the hair treated as well, getting the drip as well, because we're changing their lifestyle. So yes, a lot of patients are stuck to me for about 2-3 years, and then I become their go-to for anything. And simultaneously, I benefit from helping them with, pain issues or whatnot. So in totality, everything. And I see all kinds of patients, young, old, whoever. The best part about regenerative medicine, there's no age barrier. So I get to see all kinds of different patients. Yes.
That is good, because it's like one-point shop.
Yes, one-stop shop. Correct.
Yeah, you go for one thing, but eventually you'll go for another thing.
That's true.
Yeah, which is very essential.
Yes, I tell my patients one step at a time, but they love my results, and then of course they move on to another treatment and another treatment and another treatment from there on. Yes.
Okay. So now that we have you in Nairobi, do we have others in is this regenerative medicine popular now in other regions, or just in the city only?
It's not that popular, but I do have quite a few colleague doctors using it. You can go down to Eldoret, you will find a few doctors using the GFC. I have doctors in Kisumu who use it. I have a doctor in Bomet who uses it. I have doctors in Mombasa. But as I mentioned somewhere in the interview, I urge a lot of other doctors. I want to urge them. I request them that they must, adapt to this and try and use it for. Not all their patients will require the conventional way. There will be that chunk that can benefit from regenerative medicine as well. But yes, you will definitely find doctors using it in other parts of the country. Yeah.
So how is the reception about it?
They
is
love
it now
it.
being acceptable by many?
Still a long road,
yes.
But definitely. Patients are very well aware these days. They are very well educated. They know what they're coming in for. And even my doctors, they love it. They have very successful results. Yes.
So at least the myths are now being
on the
debunked.
way. Yes, on the way.
On the way,
Yeah.
the way to success. We are grateful, and we are really thankful that you took up the challenge, and now you are helping people the natural way. Yeah.
Thank you.
So, Doctor, what advice would you give to viewers curious about trying that now? About the safety. In fact, what we've been talking about, the safety and the effectiveness, maybe your assurance to them.
Well, I tell my patients, and I would
Yes.
tell all the viewers, you have nothing to lose. I'm removing your own blood, re-injecting back your own blood. So worst case scenario, it won't work, but you have nothing to lose. But I assure you, I have seen miracles in my practice. As doctors, we don't promise of miracles.
Yes.
But I have seen miracles in my practice. As I mentioned, it's slow but steady, and it's the way forward. And definitely, you know, come in for a consultation. There's no force. But at least once you understand the concept, you understand what we are doing, if you feel that that's the way for you, then you can go for it. Yes.
So, what do you think is the future of this?
The future is only regenerative medicine and functional medicine. Everybody, like we know, prevention is better than cure. And this is prevention. So you can get in well in time, do everything to your body to maintain it so you don't have to have a problem to look for a solution for the problem. This is the way forward. And I think in the next 1 or 2 years you will see doctors all over the world only talking about functional and regenerative medicine. Yes.
Awesome. We are looking forward to that.
Thank you.
So, Dr. Closing remarks, what is the take-home point now to our viewers when as you wind up? What do you want them to remember every other time?
I want patients to remember that they have to be natural in the most basic way. Do what suits your pocket, number one. You don't have to go all out. You don't have to just meet societal needs. Be it skin, be it hair, be it looking good, be it losing weight, and try and be as healthy as possible. And definitely we are there to treat you when you have problems.
Sure.
But like I said, prevention is better than cure. Come in for a consultation, get to know more, and you know, we will be able to give you the most simplest, easiest ways out. And I'm based in Muthaiga at TIA Clinics, and so patients can come in for a consultation. Yeah.
Thank you.
Thank you too.
That's awesome. So we are grateful and thank you for your time, that you really enlightened us on so many things that we didn't know, and now we know. So knowledge is power.
Knowledge is, yes.
Yeah.
And thank you so much for having me. It's an absolute pleasure to be here today, and you're a fabulous host. Thank you.
Thank you, Dr.
Thank you.
You're welcome again some other
Pleasure.
time.
Yes, thank
We'll
you.
be glad to have you again
Sure.
to still shed more light
Yes.
on the advancement of it as we proceed.
I will be here very soon.
Thank you. Karibu sana.
Okay, thank you.
Chitab Kalenjin kakait let nebo tetutienyon nebo Tililindo rani kakimite ak Daktari Ashni Malde ako kakonetech mising akobo ole kitoretitoi borto asikonyagei inegei ko nguno ko kanget kebeberta nengunget ak nenyunet asikisup chekakoarorwech Daktari asikenyoru chametabgei nebo borto eng oret nelel notok nebo ketoret borto konyagei inegei. Kiguran Chesang Karo nebo Arap Sirma, testai kere Kass TV, kimnatet night. Chitab Kalenjin nito ko tetutiengung nebo Tililindo neitun eng Kass TV kila Jumatatu kong'etege sait 1 nebo kemboi. Kiityini komonut mising chametabgei nebo bortongung ako noto amune asiketindoi konyoik cheng'omotik chebo konyoiset nebo mionwogik cheterterchin chebwone asikobit konetech akokuyeiwech mising akobo mionwogik ak ole kimuchi kinyaita ak ole kimuchi kekirindaita. Kou noto komatkosirin tetutioni eng kila Jumatatu asinyoru naet ak kakuyet nebo kirindaetab mionwogik chuto asikobit kenyoru chametabgei nebo borwekcho.